Good afternoon. I hope you guys are doing really well during this period. Today I'm going to start off with penicillin. Now, penicillin, you might have studied in the lower class. It was discovered by Sir Alexander Fleming, and it was in the year 1928, and it was discovered from Penicillium notatum. After that, it began its clinical use in the year 1941. And currently they obtain this penicillin from a fungus called as Penicillium chrysogenum for the therapeutic purposes. Moving over to classification, we have two main classification, natural and synthetic. Natural, we have penicillin G. Moving over to the synthetic, it is again grouped into three main categories. You have acid resistant, penicillinase resistant, and extended spectrum. When it comes to acid resistant, we just have penicillin V. Coming over to the second category under synthetic, we have penicillinase resistant category, and we have two main drugs, methicillin and cloxacillin. Methicillin and cloxacillin. Under extended spectrum, we have again classification as aminopenicillins, carboxypenicillins, and uridopenicillins. Aminopenicillins, carboxypenicillins, and uridopenicillins. Under aminopenicillins, we have the commonly used drugs which are available in the market like amoxicillin, ampicillin, and becampicillin. Amoxicillin, ampicillin, and becampicillin. Under carboxypenicillin, we have carbonicillin and ticarcillin. Carbonicillin and ticarcillin. Under uridopenicillins, we have piperacillin and meslocillin. Piperacillin and meslocillin. So today I will just start off the class with natural penicillin. And under natural penicillin, we have penicillin G. Now let's have a look about natural penicillin. Now natural penicillin is otherwise called as the benzyl penicillin. Benzyl penicillin is the other name for penicillin G. Now, antibacterial spectrum. If you see the antibacterial spectrum, it has got a narrow spectrum, antibiotic activity, narrow spectrum, antibiotic activity, and this is mainly limited to gram-negative bacteria and very few others. Gram-negative bacteria and very few other organisms. Now, there are certain highly sensitive form of organisms, and they are streptococci, pneumococci, gonococci, meningococci, and B. anthracis, C. diphtheria, Clostridia, Listeria, and spirochetes. These are the set of organisms which are highly sensitive to this particular drug. Now, when there is a very good activity on one side, we should also expect resistance from that particular drug. Now, this happens when many organisms like staphylococci, when they go for producing an enzyme called as penicillinase, which is a beta lactamase, then what happens is the beta ring gets opened up. The beta ring gets opened up, and that's when the penicillins which has been administered gets inactivated. So that's when we have this resistance caused by the particular organism to the particular drug. Alright, so usually what happens is they will be producing certain organisms like staphylococci and all, they will be producing an enzyme which is called as a beta lactamase. Okay, it's actually a penicillinase enzyme, beta lactamase. So when that is being produced, the beta ring gets opened, and once the beta ring gets opened, then automatically the penicillin drug which was being administered gets inactivated. Or there could be one more reason: the penicillin don't get bound to the bacteria due to the changes in the target proteins. So when the target proteins, they go for, or they have the tendency to change their cover, that's when it causes resistance to the particular drug. Okay, so two things to remember under resistance. One is when they go for producing a penicillinase enzyme, which is a beta lactamase, that's when automatically the penicillin gets inactivated, or when the target protein changes its nature or its cover, then automatically the drug will be getting inactivated. Let's have a glance about pharmacokinetics. Now usually penicillin, if you are giving orally, it gets destroyed by gastric juice. Alright, so one thing is it gets destroyed by gastric juice. Secondly, food will interfere with its absorption. Food will interfere with its absorption. Hence, it is given 2 hours after food. 2 hours after food. And it is said to have a short half-life of 30 minutes. It is distributed mainly extracellularly, and it reaches almost all the body fluids, except the penetration to the serous cavities and CSF is poor. However, in the presence of inflammation, therapeutic concentration is attained in the CSF. Alright, only in the presence of inflammation you can find the therapeutic concentration being attained in the CSF. It gets excreted out by kidneys, and probenecid blocks the renal tubular secretion of penicillin and thereby prolongs its duration of action. So this is all about the pharmacokinetics. So a few things to remember: it gets destroyed by gastric juice. Secondly, food will interfere with its absorption. So usually after the patient takes the food, if you administer the drug after 2 hours, it gives, or it aids in very good absorption. Also, you need to remember that it has got a short half-life of 30 minutes. Once it enters, it will be distributed extracellularly, and almost it will be entering into all the body fluids except for serous cavity and CSF. But in areas where there is inflammation, or in cases where there is inflammation, therapeutic concentrations will be attained in the CSF. It is excreted by the kidneys, and if there is like if you are providing probenecid, then it will be blocking the tubular secretion of penicillin, and it will prolong its duration of action in the body. Okay, so this is about the pharmacokinetics. Now, let's see what are the adverse effects. Now, adverse effects you can notice. First one is local irritancy and direct toxicity. Local irritancy and direct toxicity. So, usually we go for administering it intramuscularly. So you can expect pain at the intramuscular injection site. There can be nausea, there can be thrombophlebitis, and you can expect, if any toxicity appears or happens to the brain, person will start exhibiting mental confusion. Muscular twitchings can be noticed, convulsions, sometimes they go into a state of coma. And in case if we had gone for administering intravenous by accidentally, alright, like in case of procaine penicillin, we have accidentally administered intravenously, there will be central nervous system stimulation, hallucinations can be noticed, convulsions can be seen. And apart from that, bleeding can also be noticed. And second thing you can find is hypersensitivity. So in case of hypersensitivity, the patients start complaining of rashes, itching, urticaria can be noticed, fever, wheezing, angioneurotic edema will be seen, serum sickness, exfoliative dermatitis, and very rarely and very fatal problem, anaphylaxis can also be noticed. This can also cause superinfections. Okay, third adverse effects is superinfections, and it's quite rare, but we can't rule it out. Very rarely it causes the problem superinfection. Next reaction that you can notice over here is Jarisch Hexamer reaction. Jarisch Hexamer reaction. Actually, it is a release of endotoxins, which products once the microorganisms gets killed. Okay, that products will be released into the body, and that's when this particular reaction will be created. So, if the penicillin has been injected in the syphilitic patient, particularly the secondary syphilis stage, then in such patients, okay, when this Jarisch Hexamer reaction takes place, it makes the patient to experience shivering, fever, and myalgia can also be noticed. Apart from exacerbation of lesions, even vascular collapse can also be noticed. And this is mainly due to the sudden release of spirochetal lytic products. Spirochetic lytic products, and it lasts for 12 to 72 hours, and if for this particular time you may have to go for administering aspirin and sedation in order to relieve the symptoms of your patient. Okay, and uses, moving over to the uses, we can administer this in case of streptococcal infections, like in case of pharyngitis, otitis media, rheumatic fever. Okay, and usually the dose will be administered for 7 to 10 days. Then in case of SAB, that is subacute bacterial endocarditis, we will be going for administering 10 to 20 million units IV daily, along with gentamicin for 2 to 6 weeks. Then in case of pneumococcal infections, penicillin G 3 to 6 million units will be administered intravenously every 6 hours. Okay, in case of pneumonia as well as meningitis, meningococcal infections, intravenous injections will be administered at a very high dose. In case of gonorrhea, okay, this will be treated within 12 hours of exposure. Okay, then we will be giving a treatment in the syphilis. Okay, even if it is early or latent form of syphilis. Then in case of diphtheria, then tetanus and gas gangrene. Tetanus and gas gangrene we will be administering at a dosage of 6 to 12 million units per day, and very rarely it is used as a drug of choice in case of anthrax, actinomycosis, then trench mouth and rat bite fever. In such kind of uses or cases we go for its usage. Prophylactic use in case of rheumatic fever, okay, for which we use benzathine penicillium 1.2 million units, and this will be given till 18 years of age or 5 years after an attack. Then bacterial endocarditis, this will be providing protection, but amoxicillin is preferred now in case of bacterial endocarditis. Then in case of agranulocytosis patients, this penicillin can be used alone or along with an aminoglycoside antibiotic to prevent respiratory and other acute infections. Disadvantages. Like I mentioned in the beginning of the class, it has got a narrow spectrum of activity. So that is one of the first major disadvantage. Secondly, it is not orally effective. Main thing is because it is being destroyed by the presence of gastric juice. And it is susceptible to penicillinase. Like I said, certain organisms, they produce an enzyme called as penicillinase which can deactivate it. Alright, and there is a risk of hypersensitivity, even anaphylaxis, and even the major adverse effects, that is the Jarisch eczema reaction. So this is all about natural penicillin, penicillin G. I hope you have understood the class. Till then, thank you.